Many people struggle with chronic bloating, foul-smelling gas like rotten eggs, diarrhea, and a noticeable intolerance to foods like eggs, onions, or broccoli. What most don't realize is that these symptoms may be caused by an excess of hydrogen sulfide, H2S, in the gut. Hydrogen sulfide is a gas produced by certain gut bacteria as they break down sulfur-containing amino acids, especially methionine and cysteine, commonly found in protein-rich foods. While small amounts of H2S are normal and even beneficial for cellular signaling, too much of it can disrupt gut function and lead to inflammation, discomfort, and a specific type of bacterial overgrowth called sulfur-type SIBO. To reduce hydrogen sulfide levels effectively, diet is key. The first step is to limit high-sulfur foods such as eggs, onions, garlic, cabbage, broccoli, cauliflower, red meat, dairy, and soy. Reducing overall protein intake, even temporarily, can also help, as excess protein provides fuel for H2S-producing bacteria. Some people also experience worsening symptoms when taking sulfur-based supplements like NAC, N-acetylcysteine, MSM, or glutathione. These should be paused if symptoms are present. Certain supplements can support the reduction of hydrogen sulfide. One of the most effective is bismuth, often found in over-the-counter products for digestive upset. It binds hydrogen sulfide in the gut and neutralizes it. Another helpful compound is berberine, a natural plant extract with antimicrobial effects that can suppress the growth of harmful sulfur-producing bacteria. Some people also benefit from sodium butyrate, a short-chain fatty acid that strengthens the gut lining, reduces inflammation, and supports overall gut health. Probiotics can also play a role, but they must be chosen carefully. Strains like Lactobacillus plantarum, Bifidobacterium longum, and Saccharomyces boulardii do not produce hydrogen sulfide and may help suppress the bacteria that do. On the other hand, some probiotics can actually worsen the issue if they include sulfur-loving strains. That's why picking the right formulation matters. In more persistent or severe cases, especially when sulfur-type SIBO is suspected, antibiotic treatment may be necessary. The most commonly used option is rifaximin, a non-systemic antibiotic that targets gut bacteria directly. When combined with bismuth, it may help reduce both bacterial overgrowth and hydrogen sulfide levels effectively. However, this should only be done under the guidance of a healthcare provider and based on proper diagnostic testing, such as a hydrogen sulfide breath test. In summary, excess hydrogen sulfide in the gut is a real issue that can impact quality of life and digestive function. The most effective approach includes reducing dietary sulfur, moderating protein intake, supporting the gut lining with targeted supplements, and, if needed, using medical treatment to address underlying bacterial imbalances. The earlier you recognize the signs, the faster and easier it is to take action and feel better. If you want more science-backed, practical health content like this, don't forget to subscribe to our channel. And if you have questions or want to share your experience, drop a comment below. We read every one.